Still waiting for YouTube to come up. It says I'm live now. Okay. Think in October, November, and the beginning of December, the billions of dollars spent on advertising to companies that are not even insurance companies, but offer you a choice between 6 or 8 different health insurance companies. And they know the best for you because they make the most commission on you. This is getting ridiculous. Half the cost of medical insurance is insurance agents and insurance companies. Not the doctors, not the hospitals, not the labs or the prescriptions. It's the insurance companies making all the money. We're the only country in the world, first world country, and a lot of third world countries like Vietnam have great national health insurance. Why don't we? We're a country of greed. And greed has taken over our legislative bodies in our states, our cities, our counties, and the federal government, with all kinds of people in there encouraging them to vote to keep health insurance public instead of private, like Medicare for all. Obamacare was the worst crooked insurance you could ever approve. It gave the insurance companies hundreds of millions of dollars more money than they deserve, saying it saved us money. No, not in the long run. Over half the people in America is getting free health insurance, like me. I have VA paying everything because I'm a 100% disabled veteran. And I also have Medicare, parts 1 and 2, A and B, which pays 80%. And the funny thing about it, I have found out with going to a skin doctor, that my copay was $19. And while I was sitting in his office waiting, a bunch of elderly people were sitting around. Your copay's $30, your copay's $40, your copay's $25. And I get a bill a month later for $19, my 20%. And these people are paying for medical insurance, hundreds of dollars a month. And they're paying more in copay than I am without that insurance. This is all a scam of America. 60% of America either has some kind of welfare insurance or other insurance. And the funny thing about it, employers are paying through the nose. Look at your paycheck. How much did they take out from Medicare? They took out $20 this week. Guess what? Your employer has to send $40 to Medicare. Just like Social Security. If they took out $20 to Social Security, your employer has to send $40 to Social Security. Your employer is paying for Medicare, but you're not entitled to it because you're not old enough yet. We need a one-payee system, but nobody working for the government. Medicare for all. And yes, you're going to be pissed because you're not going to get a tummy tuck. A thing, raise your chin, increase your boobs, round your eyes, put a hump in your nose, get rid of some of your wrinkles. Because that is not health care. That's looks care. You want to look better? You should pay for it yourself. The Canadians I've talked to years ago in Florida, when I was down there at Daytona, where my kids were going to college, loved their insurance. It wasn't a 3-month or 5-month or 6 months to get a CAT scan. They saw the doctor the same day usually. Where our doctors here, you got to wait a week or a couple of days because they're always booked up. Even in the hospital, the CAT scans are booked up. Because the insurance companies the hospitals don't want to spend any money on it because they're hard to get paid for it by the insurance companies now. We need Medicare for all. And do away with Obamacare, which just throws billions of extra dollars to these insurance companies for nothing, except their big paychecks. Obama for all should include eye care and minimum eyeglasses. You want fancy ones, you got to pay extra. Hearing, basic hearing aids. You want fancy ones, you pay extra. Dental, up to a point. If you want fancy stuff, you pay extra. But right now, 50 to 60% of our public is on getting insurance free. And another 10 or 20%, tens of thousands of people are walking into emergency rooms of hospitals across this country. And by federal law, they got to be able to walk out. So the hospital has to treat them until they can walk out. Free of charge. No insurance. And a lot of these are American-born citizens. It's not all illegal aliens doing this. And they walk out after giving a phony name. And the hell with paying. We need health care for all, as long as you are a citizen of America. I'm going to be talking about legal and illegal immigration in my next video, which will shock you what I think about our Constitution and our Bill of Rights and subsidies. But right now, we need national Medicare. And I'm a Republican, but I'm not for greed, which a capitalistic society is based on greed, running rampant now that we got the internet and TV and cell phones and everything. Companies can get away with screwing tens of thousands of people. Where in the past, when I was a kid in the 50s, everybody knew which businesses were good and bad because word of mouth. People talked about businesses, how they got screwed here or there at the mom and pop businesses, and people stopped going, so they went out of business. But that's not happening anymore. The bigger businesses are getting bigger and bigger and bigger and screwing more of us, and there's no payback by them. And most of it is by insurance. So think what I said. When 50 to 60% are getting free health insurance, another 10 to 20% is getting free by not paying when they go to the hospital. Why can't we cover the other 30% or 40%? Medicare is solvent for another years. They'll be taking in a lot of extra money that they don't have to pay out. And Social Security for another 20 years. They're estimating it will be taking more money in than paying out. But yet, the money's going down a little bit. And the government don't like that. They like that tax revenue they can steal from and put IOUs in to Social Security and Medicare. All those hundreds of millions and billions of dollars they're taking an extra a year is like a cookie jar for the federal government. So let's stop this and let's get Medicare for all that includes eye, teeth, and hearing. Somewhat. Thank you very much. And think what I said about the billions spent on advertising. Every damn TV channel I turned on, even the cable ones, constant advertising. Call us to get the cheapest Medicare rate. We have 8 companies to choose from, and we'll tell you the best one to go to. Not even insurance companies putting all these billions of dollars of advertising. Nationwide. Is there that much money in profit for them? Yes. And we got to stop it. Thank you very much for listening. You have a nice day now. I'm taping this on my camera too, because my cell phone's out in my car, turned off. So I'll be downloading it on Facebook soon. Good night. God bless. And remember, Medicare for all.